Hi, my name is Kileo from the Kilimanjaro Centre for Community Ophthalmology, and I'm here to present to you a topic on reaching the unreachable through women microfinance groups in Africa. This presentation contains 4 parts. Part 1 is a summary of SevaCanada programs in Africa, and Part 2 is a description of the characteristics of these women microfinance groups and why we chose to partner with them. Part 3 is the evidences on the success working with these women groups in Africa, and Part 4 is the opportunities for expansion of these programs in Africa. SevaCanada supported programs in Africa are spread across the continent. We have 2 programs in Tanzania, and then we have a program in Malawi. We have 4 programs in Madagascar. We have a program in Congo Brazzaville. We have a program in Uganda, Ethiopia, and Benin. Women microfinance groups are voluntary self-help groups formed by women to support each other economically through microfinance initiatives. Women in these groups are respected members of the society and have proven to be very effective in identifying and referring suspected cataract or trichosis cases to the outreach camps in their communities. At KCCO, we work with these groups through the local communities, and it's the local authorities that identify the efficient groups to work with us in their communities. And then one-day training is organized and eye health education is provided on how to identify either trichosis or cataract cases and where to refer these cases that are identified in their communities. In exchange, we provide to these women technical support for their initiatives. So we have success stories working with these women groups. One of the ways that we think that has been very effective is looking at the statistics that we have between 2 programs in Tanzania, and that is the Dodoma program, which does not receive women microfinance support, and a program in Mwanza called Bugando, which received women microfinance support. If you look at the number of the patients that were screened in Mwanza in the year 2018, we have about 4,000 cataract patients that were screened and referred for treatment. And if you look in comparison, if you look at Dodoma, we only have about 2,000 cataract patients that were screened and referred for treatment. So we see there is almost twofold if you compare the Dodoma and Mwanza, and we think this is attributed to the success of women microfinance groups. Again, if you look at the year 2019, we have about 5,487 patients that were screened in Mwanza, whereas in Dodoma, we only have about 3,885 patients that were screened and referred for treatment in Dodoma. So this comparison shows us that there are more people receiving services in Mwanza compared to Dodoma. We also have a comparison of the number of people receiving surgeries between these 2 programs, that is Dodoma and Mwanza. If you look at the number of people that received surgeries in Mwanza, in 2018, we have 332 surgeries for Mwanza, and we have 278 surgeries for Dodoma in 2018, while in 2019, we have 454 surgeries that were done in Mwanza, and we have 370 surgeries that were done in Dodoma. So we think again, when it comes to service uptake, as related to number of people getting cataract surgeries, we have more people getting cataract surgeries in programs with women microfinance groups as compared to areas without women microfinance groups. We also have an evidence of a program in Ngorongoro, Tanzania, which deals with both trichosis and cataract services. And we have data that shows us the number of services, the number of patients that were referred by women microfinance groups for servicing. In 2017, when the program started in Morogoro, we had about 228 cases that were referred for treatment. But in 2018, we had 461 services that were referred for treatment. And in the year 2019, we had a leap of 2,528 patients that were referred for treatment. So if you look at the graph, from 200 to 2,000.5, it's a huge increase in these areas with women microfinance groups. And this gives us an evidence that there is an opportunity for expansion of these programs in other different areas in Africa, especially in areas that do not currently receive women microfinance initiatives. And we think if we have these, then we can get more people getting services in those areas. We also think there is an opportunity for conducting operational research in these areas so that we can see the effectiveness of this program in different contexts and setups. Thank you very much for your continued support.